G'day, Brad from Men's Health Then Under here. Little video now on intracavernosal injections and how to administer them, particularly those that are compounded or made in a sterile compounding laboratory. Here in Australia there's very few of these, so these can be hard to find. So if you're having trouble finding where you get them from, get in touch and we'll put you in touch with the right people so you can access them. So these are things like Trimix, Bimix, Quadmix, and they could have all different ingredients in them as prescribed by your doctor or urologist typically. Right, this is how they often come in a little plastic container like this, and inside that you take the little lid off it. Inside it there is a little vial. It looks like that. It's got a little rubber bunger on the top, and that's where you put the needle in to draw it up. You'll notice it's always brown, the bottle, and often comes in an amber plastic container, and that's because the drugs in these are often light sensitive. What that means is that when the drug is exposed to light, be it UV light or artificial light, the drug can break down, and if the drug breaks down it becomes less effective and then it doesn't work as well. So that in itself is a problem. So we want to make sure that it's protected from light. So I would always say to the patients, keep it in a little bottle, and then this should be brown. And then the other thing that's important to note with these things is they are temperature sensitive. What that means is they need to be kept cold in the fridge, and if they go on an excursion outside of that temperature, the drugs will break down more quickly as well, which again will make it less effective for you. So it's really important to keep it cold and keep it dark. To that end, you can actually get the little foil bags from your local pharmacy. They're like a little cold bag, a little foil bag. They often give them out for free, and I would also suggest to the patients that you get that little foil bag, put the medicine in the bottle, put it in the foil bag, wrap it up and chuck it in the fridge. Righto, moving right along. So that's how the medicine comes. What we need to do to inject this stuff is we're going to need some needles. What we tend to use is the insulin syringes, and again these can be hard to find at the local pharmacy because they are pretty specific, and we don't use them for diabetics anymore. The needle on the end of them is too long. And there's a couple that you can get. They're typically made by BD or Terumo, so they're the two main suppliers of needles in Australia. I would generally suggest the one to use is a 1 ml or 100 unit syringe. I don't know if it's going to pick this up, we'll try. That's a 100 unit syringe, which is equivalent to 1 milliliter. This little bloke here is another one which is really handy to know exists. It does 2 unit increments. It's not a 1 unit increments, it's not going to pick it up. But a 1 unit increment syringe is useful, particularly if you're on a really low dose or if you have a really strong reaction to the medication. You can actually get a syringe that measures 1 unit doses. So you might find that the doctor, the urologist, starts you on a dose of say 5 or 6 units of this stuff. And that would be relatively conservative. If you have a strong reaction to that, you might say, gee, I might want to cut it back to 1 unit. And you can't do that on a 1 ml syringe, a 100 unit syringe. You're going to have to do that on a smaller syringe. So the smaller syringe is 0.5 milliliter, and it goes up in 1 unit increments. The 1 ml syringe, which is 100 international units, it goes up in 2 unit increments. So just an important point to note. If you're having trouble finding them, get in touch, let us know. We'll be more than happy to either supply them or help your local pharmacy find out where they can get them from. So you need a needle, you need an alcohol swab. Alcohol swab is important because we need to make sure that product stays sterile. Yes, the light will degrade it and temperature excursions are no good for it, it's got to be kept cold. But the other thing we do not want happening to that is a bug being introduced, so we need to have an alcohol swab. The other place the alcohol swab is that you would use that is on the shaft of the penis to make sure it's kept clean. Righto, so alcohol swab, you want to tear that to open it. The pad inside is made of a fabric, so you can really roughly tear it through the belly, and you're not going to rip that alcohol swab. So the alcohol swab comes out, it's this little square like that, and what you want to do is wipe the end of the vial to make sure it's clean. Keep that alcohol swab because we're going to use that later. Right, that medication vial's now been swabbed. I've got a new syringe. We use a new syringe every time because what we don't want is a bug being introduced, and the syringes are really cheap. We take the orange cap off. You can see that needle, perhaps. The needle is 1/2 inch long, so 12.7 mil long. It's important to note, one of the most common questions we get is, do I have to put that to full depth? The answer is typically yes. If we don't push that in full depth, we're at risk of not getting that into the right part of the penis. And if that occurs, the medication is going to either not work or not work as well as it should work, or cause a lot of pain. And none of those things are ideal when we're trying to induce the erection, be it for rehab, to get blood flow into the penis, or for the purpose of getting an erection to have intercourse. Right, so we've swabbed the top of the vial with the alcohol swab. We've got our syringe, taken the cap off, and what we want to do is insert that needle really carefully straight up and down into the rubber bunger. Now, if we put it on a funny angle, we can run the risk of bending that needle, and it's as thick as a hair. And if we bend it, there is a risk that we can break it. Now, we certainly don't want to break that needle. Once it's been pushed through the rubber bunger, as you can see, it will very happily sit there in that vial upside down, with an amount of dexterity that you then need to draw the dose up. The reason we tip it over is that the medication often doesn't fill the vial. So this vial has got 6 ml in it, it's about a teaspoonful, but that vial would probably hold 12 ml by the looks of things. So by flipping it upside down, we're ensuring we're not going to draw up any of the air, because air won't work when we inject it. And that needle is now completely covered by the liquid, in this case the Trimix, within that vial. With an amount of dexterity, and it's hard to show, but basically what you're going to do is you want to pull that syringe back, the plunger, and draw the medication in. You can pull it back really quickly. Now what's going to happen is that's going to flow into the syringe. Now I would always suggest overdrawing it. So what I mean by that is, if the directions say inject 6 units, pull it right back to 20 or 30 or 40. It doesn't really matter how much you pull in. That's then going to allow you to push that plunger back up to the correct dose. And in this case, I'm just going to draw up 10 units because it's nice and easy. 10 units. And by doing that, we've expelled any air that might have been in the top of that syringe. And that's important because we want to get the full dose. We don't want to lose, 10% of the dose in an air bubble. So we're going to reiterate, we're going to overdraw it. So we draw right down to 30 or 40 units and then push it back up to the appropriate dose, in this case 10 units. Turn the vial back over, withdraw that syringe, pop that, remember, back in its little container, put the lid on, pop it back in the fridge. We want that to last and last and last. So that's going into the fridge. That syringe is now ready to go. It's ready to be injected into the penis. What we're trying to do when we inject in the penis is we want to inject into these two parts, the two green hatched bits. That's called cavernosal tissue, and it runs down the shaft of the penis, a chunk on each side. It's spongy, like a cigar, if you can imagine a porous cigar. It's got lots of little holes in it. It's made of blood vessels, and when we dilate those blood vessels, when we open them, the penis fills with blood and becomes erect. To get this medication into those cavernosal tissues, we need to do it in a certain fashion. We need to inject in a certain technique. And frankly, it can be quite off-putting, this idea of injecting into the penis. For a lot of guys is really unnerving. They haven't injected before. So I get it. It can be off-putting. The process is straightforward, and typically, and I say typically because it's not true for all guys, typically it's a fairly painless exercise. The pain tends to be in here. It's one of mental anguish of putting the needle in. Typically, not for all guys. So what we want you to do, and it's a pretty straightforward process. It really comprises of 3 simple steps. Step number 1, if you're circumcised, easy done. If you're not, you need to retract the foreskin. You want to pull that penis by holding it behind the glans. The glans is the head of the penis. You want to hold it behind the glans and pull it straight out in front of you. Now you can either hold it behind the glans like this, or come over the top and get a good grip on it like that. What we're going to do is we're going to stretch that penis right out in front of us, nice and straight. Not up, not down, not left, not right, straight out in front. And I typically get the guys to do this in the standing position so that there's as much length on their penis as possible. So stand up, squeeze your bum cheeks together, get the foreskin out of the way. If there is a foreskin, if you've had a prostatectomy and your penis is a bit shorter than usual, you can have a collection of skin starting to come back on the penis. It can look like it's developing a foreskin again. Quite normal. Get all that skin out of the way, hold the penis nice and tight behind the glands, pull it straight out in front, like a nice little arrow, nice and tight. You want it, if it was a guitar string, it'd be tight, nice and tight. We don't want it wriggling when we inject it. So that's step number 1. Pull the penis straight out in front, right? Nice and straightforward. Step number 2, remember that alcohol swab we used to do the top of the vial? Wipe the surface of the penis where you're going to inject. And again, this is just about reducing the likelihood of getting an infection. So pretty important. So wipe the surface of the penis. If for some reason you forget to do this, don't fret. It's generally all right. It's probably not going to cause a big issue, but just be careful. If you can remember to do it, you're much better too. So I've swabbed the surface of this penis, and it's now clean. So we've stretched it out, step number 1. We've stretched it out in front of us. Step number 2, we're coming in at the correct angle. And the correct angle, if you think about the clock face, you don't want to inject at 12 o'clock. You don't want to inject at 3, and you never inject on the underside of the penis. You don't want to inject at 9. So that leaves us 1 o'clock and 2 o'clock, or 10 o'clock and 11 o'clock. So that is the angle that should come in. A lot of the guys will say, oh, that's sort of the position you put your hands in when you drive the car. And that's exactly right. If you're holding the steering wheel, you hold it at sort of, 10 and 2. That angle will ensure that we get the medication into the cavernosal tissues, which is where we need it to go to dilate the blood vessels, to open them up so that the penis becomes erect. So, we've pulled the penis straight out in front of us. We've swabbed the surface so it's nice and clean. You want to avoid any big knobbly blood vessels. There's plenty on the penis. The little capillaries, the small blood vessels, don't fret about them. And pick a spot somewhere on the shaft of the penis. It can be anywhere up and down the length of the penis. It really doesn't probably matter too much. I would normally say don't inject within a finger length of the base or a finger width of the head, the glands, because it can be a little more uncomfortable. So somewhere mid-shaft is fine. And again, get that angle right. So the angle should look like that. Okay? Now, when you do the injection, it's a bit like holding a dart. You want to hold the syringe right down low. No fingers up here over the plunger, because you could run the risk of pushing that plunger as you inject it. So hold the syringe right down low. It also means you're going to have less of a shake, less of a tremor. And if you're holding it up here and it's shaking, you're at risk of putting it in the wrong spot, and that is going to be uncomfortable. So hold it right down as low as you can near the needle so that you're nice and steady and it's going to go in the right spot. I always use my little finger as a guide, and you can just rest, use your little finger as a rest, and then get the needle in at the right angle. And the right angle is about that angle. And you don't have to push it in slowly. You can push it in pretty quickly, in full depth of the needle. That's now in at that sort of 2 or 10 o'clock position, and it's full depth. Once the needle's in, so you pushed it in, then you can pop your finger up over the plunger, press the plunger down, count to 3 once it hits the bottom. 1, 2, 3. That'll just ensure the medication has exited the needle, and then you can remove that needle. That is sharp. That goes without saying. Be careful with it. You don't want to prick your finger. Pop that somewhere safe. And the best place to put it is in a sharps container. So they're the little yellow rigid plastic containers. If you haven't got one, get one from your local chemist. Pop it into that. That way there's no risk of anybody jabbing themselves on the needle later, which can be uncomfortable. That's step number 2, the correct angle. As a word of advice, try and rotate that site, be it left-hand side, right-hand side of the shaft, move it up and down the length of the shaft. What we don't want you doing is injecting in the same spot every time, because eventually you're going to develop some scar tissue. Now that could just present as a bit of hard tissue. When you feel the shaft of the penis, it feels tough, and it may have no impact on erectile function at all. What it can do for some blokes is cause the penis to bend and bow, which is what we call Peyronie's disease, and the penis can end up looking like this in the erect state, or sideways. We don't want that happening. So do your best to try and rotate sides, left and right. Obviously, if you're right-handed, it's going to be easier to inject on the right-hand side, so therefore coming over the top and injecting on the left could be tricky. I get it. Do your best. And if you can't inject on the opposite side, so if you can't do left-hand side, right-hand side, left-hand side, right-hand side of the shaft, move it up and down the length of the shaft as best you can. So step number 2 is the correct angle, so that 10 or 2. Step number 3, nice and straightforward, and this is the step that most of the guys forget, is good firm massage. And massage is not like masturbation. Massage, I tend to suggest the guys do it with their fingers. and it's almost like this sort of an idea, up and down the shaft of the penis. It should be about as firm as a handshake. You've got to remember that little dose we inject, so 10 units is 0.1 of a milliliter. It's about 4 drops on the bench. It is not much medication. So the volume is really small, and we need to spread that medication right throughout the shaft of the penis. Now, this bit that hangs out the front of your body, that's easy to massage, right? You can go up and down that, no trouble. This greeny bluey tissue that comes right down in here, down, this is your rectum, so that's where the bowels are. The bladder's up the top here. Prostate here, if you've still got one. That greeny bluey tissue is penile tissue. So the penis extends inside your body, not just externally, but internally. And you want to make sure that medication is distributed through the external part of the penis, this bit, but also the internal bit. And to massage that, just hold the penis nice and firm, massage the outside part, and then you'll be able to feel this tough, gristly tissue going back inside the body, sort of above and behind the scrotum. Get in and massage that too. It shouldn't hurt, but it should be firm, and you want to do it for at least 30 seconds. If it's longer than that, no problem, but 30 seconds minimum massage is perfect. And that is the step I tend to find most guys forget, because they've done the injection, they go, hallelujah, it's done. And at that point, they put the needle down and they say, okay, now we give it time to kick in. So about 10, 15 minutes for it to really hit its straps. And then they can't figure out why it didn't work as well as when they did it at the clinic or with the doctor or with us, or a previous experience where they did give good firm massage. So we need that drug really well spread. So to recap, penis, hold it behind the glands and stretch it right out in front. Nice and tight. We don't want that penis wriggling. Step number 2, get the correct angle, swab the shaft of the penis and inject at the correct angle. And that angle is 10 o'clock or 2 o'clock. It goes full depth into the shaft of the penis, holding it like a dart so we don't wriggle too much and we're not at risk of pushing the plunger before we get the needle through the shaft of the penis. Push it in full depth, fingers back around, push the plunger down so that the medication's injected. Wait 3 seconds once the plunger doesn't go any further. Withdraw the needle, and then the third step, really straightforward, good firm massage for 3 seconds, and then allow the erection to kick in over the following 10 to 15 minutes. A lot of the guys report feeling the erection starting to come on even within a minute or 2 of doing the injection, and that's really normal, but it will take that sort of 10 or 15 minutes to really hit its straps. Obviously, if the dose you use is too low, it probably won't get to full erection. Equally, if you use a dose which is too big, you can end up with what we call priapism, or a prolonged erection, and that's a dangerous position to end up in. So always increase the dose slowly according to your doctor's instructions, or it may be a nurse or whoever's advising you on how to do it. So slowly to get up to the point where you get a nice erection that should last about 45 minutes to an hour and a quarter. That would be ideal. And at that duration of erection, it's probably going to be in the vicinity of 75 to 85% erect, which is more than adequate for penetration typically. If we wanted to get a penis which was 100% erect, it's going to require a bigger dose, and it is going to hang around for longer. So it might last 2 or 3 hours, maybe 4 or more, which is dangerous, and we don't want that to happen. So resist the temptation to bump the dose up too high, because it can be detrimental to the health of the penis, and we don't want that to occur. And short of that, it becomes really uncomfortable after it's been erect for much more than an hour, and the guys are typically wanting to make that erection go away. I'll do a video shortly on how to manage a prolonged erection, because it is really important, and it's something that all guys doing penile injections should be aware of. So stay tuned, and if you've got any questions off the back of that, post them below or get in touch via menshealthandunder.com.au. Good on you. Thanks, boys.